Ladies and gentlemen, you're welcome to this important Psychiatry masterclass on schizophrenia. I'm Dr. Prosper Tettey Doe in the United Kingdom and presenting which will cover these areas: definition, the types, NICE guideline, National Institute of Clinical Excellence, DVLA, and then causes of schizophrenia, treatment with side effects. So, definition: schizophrenia, according to the ICD, National Classification of Disease, these symptoms should persist for at least 1 month, and we'll come to the symptoms. And this should be one of the following: either there's a thought alienation or thought echo, or there's a delusion. And there are various types of delusion, as mentioned in previous presentation, masterclass: delusions of control, delusions of influence, delusions of passivity, delusions of persecution, or two of the following: hallucinations. That's a false perception without a stimulus. Neologism, forming new words which do not exist. Catatonia. Negative symptoms, which include apathy, speech or affects, that's the mood. There are types of schizophrenia. There's a paranoid, hebephrenia, catatonic, residual, simple, and schizotypal disorder according to ICD-10. And with the ICD-11, one could also compare it. It's not too much difference. Now, the NICE guideline, it states that atypical antipsychotics are the first line, and the use of depot injections if the patient is non-compliant. Also recommends that clozapine can be used after 2 antipsychotics, including atypical, have been used for 6 to 8 weeks with no improvements. And this is what is usually referred to as a treatment-resistant type. DVLA is important in terms of driving and licensing. In a well-stable condition for at least 3 months, one is allowed to drive. Schizophrenia is a treatable mental illness which affects thinking, emotions, and behavior. And 1 in 100 people during their lifetime will experience schizophrenia. So it's quite prevalent. And their causes are genetic, about 50%. It's also associated with illicit drugs and also associated in inner cities, and stress also brings it on for those who are predisposed. And the side effects of medication includes the following: stiffness, restlessness, the mouth and the tongue movements, what we call tardive dyskinesia, and this happens in 1 in 20 people. And for the atypicals, antipsychotics, the side effects are sexual problems, weight gain, diabetes, what one refers to as metabolic syndrome, And in treating this condition, we need multidisciplinary team of professionals, including doctors, nurses, social workers, psychologists, occupational therapists, etc. So, ladies and gentlemen, this is the end of the presentation on schizophrenia, and I wish you all the best in your career.